How should we react if that does happen? If there is some new variant, what should we have learned from the last time? What should we do different?
Well, I mean, people should do their own research, and but the research out there, and CHD has posted all of these studies on its website, the Children's Health Defense, which it's one of the first things that I did when they had mask mandates the last time around. As I said, let's see what the actual science says about masks, and what the actual science says that they don't work to prevent the spread of respiratory viruses. And there's, study after study. In fact, the CDC has admitted that they're not scientific based. I think it's disturbing if they do that again. But, one of the things that happened is we created this terrible precedent where the government has shown that people are willing to comply when it violates the Constitution. And we did this with free expression. We did, they closed the churches for a year with no due process, no just compensation, no scientific citations ever. They never showed us a scientific citation that said this works. And they've all admitted that now. Everybody's admitted in the government that these were not science-based. They shut down, for Black Americans, it was, it really shouldered the disproportionate burden of the injury from these mandates. They closed 3.3 million businesses with no due process, no just compensation, no public hearings, no notice and comment rulemaking. All of the instrumentalities of democracy were utterly ignored, and you had just one unelected bureaucrat who's been there for 50 years, never won an election, who says that 1 week masks don't work, honestly, said it privately and publicly, and then a month later, everybody put them on, and then a week after that, put 2 on. The arbitrary, the capriciousness of those mandates was obvious to anybody who had any kind of skepticism or capacity for critical thought. And, 41% of Black-owned businesses at close will never reopen. You talked about Milwaukee. I was in the Lee Harvard neighborhood of Cleveland a couple of weeks ago, and all of these businesses that were flourishing businesses are all boarded up, and some of them had 4 generations of equity, of sweat equity, of investment from African-American families, and they're gone. I sat down for an hour with a woman who owned one of the last functioning businesses, Black-owned businesses in the neighborhood, which was an 80-year-old sausage company. And she's about to close. This is 3 weeks ago. Because the inflation and the higher interest rates, and now that all come from printing $16 trillion, have now made it impossible for Black-owned businesses to get loans, because the local community banks, which are the only ones that serve those communities, their treasury bills have dropped in value, and they now are hoarding their liquidity. And there's no, you see that these Black communities are now starved for liquidity. There's no money available to businesses, even when they're flourishing businesses. And it's just systematically taking wealth, robbing wealth out of these communities. Well, the biggest, since the pandemic, the biggest cause of death in Black teens is suicide. The children during the pandemic, according to the Brown University study that anybody can look up, toddlers lost 22 IQ points. A third of kids who went through the lockdowns in elementary school are going to require remedial education for the rest of their careers. They will never reach income levels that they would have reached, because that's dictated by how you do in high school. It's very, very, it's a strong statistical correlate. They went into where I live in Brentwood in LA, and I go surfing up at Point Deux in Malibu, and the police came onto the beach and were giving $1,000 tickets to surfers around the ocean, sending them home when this is a disease that doesn't spread outdoors, and where sunlight protects you because it creates vitamin D, and they're sending them indoors where they're going to get it. On Black neighborhoods, they were going in Compton and Watts, in Lee Harvard, and Harlem. They're going into Black neighborhoods and padlocking the basketball courts. And where they couldn't padlock them, they were removing the rims from the basketball hoops to keep people from doing something that was actually keeping them healthy. The only indicia, and for Black kids, now they're at home. And as you know, there's a real problem in urban Black neighborhoods in the summertime because Black kids are not getting nutrition. They're eating potato chips and they're scrounging and, not having any kind of regular meals. The only decent food they get is when the schools open. And now you shut down the schools. And the only indicia of social deterioration that actually improved during the pandemic was child abuse. The number of reported abused children went down. But that wasn't real. It was the artifact of reporting requirements or reporting systems, because most child abuse is reported by the schools. And we closed the schools and we locked those kids at home with their abusers. 55% of American teens, Black and white, reported suffering abuse during the pandemic, and 13% physical abuse. That number is 5 times what it was before the pandemic. And then you look at what we did internationally. There were 10,000 African children dying a week from starvation because of the lockdowns, and I think 270,000 brown-skinned kids in South Asia who died from starvation. And then another 50,000 died from malaria because they couldn't get malaria treatment like quinine. And, ivermectin and hydroxychloroquine, which are, so they couldn't get that during the pandemic. And it was just, the mayhem to Black kids all over the world. One of the interesting things, Jason, is that we were told at the beginning of the pandemic that, the people who are going to really get destroyed by COVID were going to be people in places like Haiti and Africa, because they wouldn't be able to get vaccines. So, but what really happened? Black Americans were dying at the rate of over 3,000 COVID deaths per million population. They're the highest COVID death rate, Blacks in this country. In Haiti, they were dying at a rate of 14 per million population. They only had 1.3% vaccination rate. And they were dying at a rate 1/200th of American kids. Nigeria, 15 per million population, 1/200th of American Blacks. Why is that? Well, part of the reason is that they're younger. Those are younger populations, and COVID targeted the elderly. But that doesn't explain it all. And for example, Japan, which has the oldest population in the world, had 1/10 the death rate that we did. So why were American Blacks dying at these extraordinary rates? Why did we have the highest death rate from COVID on Earth? We have 4.2% of the world's population. We had 16% of the world's COVID deaths. Why did that happen? Nobody answered that question. Oh, Anthony Fauci has $4.2 billion budget. He's got 56,000 scientists at universities all over the world doing research on any question that he wants answered. Why wouldn't you ask that question? Tell us why Blacks in Haiti were dying at 1/200th the rate of Blacks in America, and we predicted that blacks in Haiti would die at 10 times the rate of blacks in America. Why didn't it work out that way? What did we do wrong in this country that was slaughtering Black Americans? And, you know, I can think of a lot of reasons why that happened. One of the reasons is just disproportionate access to decent health care. That you take poor people, you put them in a hospital and don't allow their family to visit, so nobody's watching what's happening, and you're then paying the hospitals per COVID death. And, you know, incentivizing hospitals.
I also think, though, you can break someone's will to live. And we do that on a daily basis to Black people in America. Hey, you can't make it here. This country is totally unfair to you. You might as well kill yourself because your life's going to be miserable and your kid's life's going to be miserable. Broken will is one. And then two, I don't want to, I keep it 100% real here on this show. Our obesity rate in the Black community.
No, the chronic disease rate among Blacks is huge. The things that kill people with COVID, diabetes, obesity, lousy foods, low vitamin D. Every Black in America has low vitamin D, and there was a direct correlation between vitamin D deficiencies and COVID death. Asthma, I think now 1 out of every 8 Black kids has asthma in urban areas. And these were the comorbidities that were killing people in COVID. So the chronic disease, we have the highest chronic disease rate in the world, and Blacks have the highest chronic disease rates among Americans. You know, that's something that, you know, that's something the government should be worried about. You know, that's a crisis. The people who died from COVID, according to CDC, the average American who died from COVID had 3.8 chronic diseases. Oh, it wasn't COVID that was killing Americans. COVID put them over the edge of the cliff, but they were already standing at the edge of the cliff because of chronic disease. And why aren't we addressing that issue? You know, why weren't we telling people you need to take vitamin D, you need to stop drinking big gulps, you know, and
exercise, go out and walk,
go outside,
eat less, all kinds of just common sense things.